Emergency health crisis in China. Overcrowded hospitals amid rising viral infections. China is facing a severe health crisis as hospitals across the country, particularly children's wards, are overwhelmed by an unprecedented surge in viral infections. Social media platforms are flooded with alarming reports from citizens and healthcare workers, painting a grim picture of overcrowded facilities, overburdened staff, and patients struggling to access care. Children's hospitals overwhelmed. A blogger from Beijing reported that the most crowded places right now are not shopping malls or train stations, but children's hospitals. Parents are lining hallways, some with camping gear, as they wait for drips for their children. Many young patients have developed pneumonia, with symptoms often going unnoticed until they worsen, leaving families unprepared. Hospitals in Shenyang, Shanxi, and Guangdong report similar chaos, with patients waiting up to 24 hours for treatment. Emergency rooms and outpatient clinics are seeing a tenfold increase in cases compared to last month, primarily due to respiratory infections caused by a mix of viruses, such as flu, adenovirus, and human metapneumovirus and beef. Pediatric wards are full, with some patients being treated in makeshift spaces. Emerging viral strains and alarming fatalities. Healthcare professionals have warned of new viral strains causing severe respiratory illnesses. In Jiangsu, a doctor revealed that 6 out of 30 pneumonia patients in his ward had died, with 3 others in critical condition. Experts say this unidentified virus spreads slower than COVID-19, but has a higher fatality rate. The Chinese Center for Disease Control and Prevention (CDC) acknowledge a rise in acute respiratory infections, but dismiss the emergence of new strains, attributing the surge to existing pathogens. Families and healthcare workers struggle. Reports from across the country describe heartbreaking scenarios. A family in Anhui, who had isolated at home to avoid infection, found themselves battling high fevers and severe illness. Another family in Beijing shared how multiple generations were infected after one child brought the virus home. Healthcare workers, including radio station employees, report widespread illness among their teams despite wearing masks and taking precautions. Government response under scrutiny. The Chinese government has faced criticism for its handling of the crisis, with citizens comparing the current situation to the pandemic peak in December 2022. Many accuse authorities of downplaying the severity of the outbreak and suppressing independent investigations. The lack of transparency has fueled public skepticism, with some suggesting that current infections are linked to lingering effects of COVID-19 or its variants. Urgent warnings and precautions. Doctors are urging parents to seek immediate medical attention for children showing symptoms like persistent fever, severe coughing, or difficulty breathing, as these can quickly escalate to pneumonia. They warn that early diagnosis and treatment are critical. Citizens are advised to wear masks, avoid crowded places, and ensure adequate hygiene to reduce the risk of infection. A call for global attention. The situation in China has raised concerns about the potential for these viral infections to spread beyond its borders. As hospitals struggle to cope and new strains potentially emerge, experts emphasize the need for international cooperation in monitoring and addressing this growing public health threat. Thank you for watching my video. For more videos, please like, share, and subscribe.